Okay, Project Search interns, it's Danny Matthews, and today I'm going to talk to you about emergency codes. And of course, those are those codes that we might hear over the PA system at the medical center. So we'll talk about two things. What do they mean? And what do you do when you hear one? I've arranged this so that the more common codes that you might hear first, and then we'll move on to the ones that are a lot less common. So the first one is the code blue. When you hear a code blue, that means someone has lost consciousness and could be in cardiac arrest. Medical professionals will respond to the emergency. Project Search interns should stay clear of the area where the emergency has taken place. So you're staying away, of course, from the area where there's a code blue because you don't want to impede or somehow create a barrier for those medical professionals, the doctors and nurses and so on, who are trying to save that person's life. And then we have our code 5. Code 5 is similar to a code blue in that it means that someone's in cardiac arrest. Unlike blue, instead of it being an adult, the person who could be in cardiac arrest is an infant or child. And so you're going to do the same thing that you would during a code blue, and that is, of course, to keep on doing what you normally would do as long as you are out of the way of the people responding to the emergency, the medical professionals responding. The reason why there's a code 5, by the way, is because there's a separate AED that's used for a child or infant. So the responders will need to know which AED they need to bring to appropriately respond in that scenario. Code red. If a code red is announced, that means that a fire or signs of a fire have been observed. If you are in an area affected by the code red, you should exit the area immediately. If you are not in the area where the code was indicated, follow instructions from your managers, mentors, and Project Search staff. So at UTMC, it's such a huge campus and a lot of separate buildings and wings and that type of thing. You may hear a code red announced, and it does not mean that you need to exit or evacuate. So you're going to need to listen to instructions from whoever is the leader or in charge, so to speak, of that area. You should, of course, have managers and mentors if you're in a department doing your internship work, your job coach, or your instructor may be with you in the classroom or somewhere else in the hospital, and say always, in other words, ask us what to do if you're not sure in a code red, unless you are in the area where it's actually happening, and then you'll leave that area right away. Code green. If someone's behavior becomes violent or threatening, then a code green is announced. The medical center's police officers and other designated personnel will respond to the situation. Project Search interns should not go to the area where the incident is taking place. They should continue their tasks as usual. So code green means someone has become violent. You do not want to go to wherever that is happening. Stay away and let the people who are trained to respond do their jobs. Okay, now there are several other codes, as I said before, that are a lot less common. You just aren't going to hear them as much. And those are code orange for a hazardous incident. Typically what that means is there's been some type of a spill or an accident that's taken place somewhere in the medical center, and we need to make sure we don't go to that area. There will be special teams from various departments who will respond to those things, whether it's a spill of a hazardous material or perhaps there's been some type of a leak of some type of fumes or whatever like that that can be harmful to people. So we will continue doing what we typically do unless we are told by hospital personnel to leave the area we're in. And then you have a code pink, and that is an infant or child abduction. During a code pink, it's all our responsibility to keep an eye out for any suspicious activity. Remember that it's a very serious situation where someone has tried to take a child who they are not supposed to take, basically. And so we all need to keep a lookout. And if we see something that seems strange, inappropriate, then we need to report that to a manager, to a security officer, to your project search staff person. But and then also you can't leave the building during those code pings. You'll have to wait until it's cleared. So code gray is for tornado. We don't get as many tornadoes in our area as they do in some other areas, but it can certainly still happen. So if you hear that, then you'll need to make sure you get away from any windows, get inside immediately, away from outside walls, and listen to the instructions of your managers and mentors. If you're in a project search classroom, you'll follow the instructions of your instructor or job coach. Yellow means mass casualty or surge. This one should not typically affect anything that you'll be doing as an intern. But again, with everything else, you are going to follow instructions from your manager, mentor, job coach, or me. But what that means, though, is that with the mass casualty surge is that there's been suddenly a large number of patients have arrived in a short amount of time who need medical care. And so the hospital has to go into follow certain procedures to deal with that. So not much of a chance will be affected as project search, but we still need to follow any directions we're given. And then purple is shooter hostage situation. So you're going to stay in your area unless you're in the area where this incident is taking place, and then you'll try to run from wherever that incident's taking place and try to get yourself to somewhere safe. It's very important that if you hear that announced, that code purple, that you don't just run away from whatever area you are in, because the area you're currently in, when it's called, it might be perfectly safe, and you may end up away in getting yourself into harm's way. So we will cover that again during project search and talk about some strategies for that. Code echo means that the building must be evacuated right away. So this is a situation where wherever you are and whatever you're doing, you drop what you're doing and you leave the building by the fastest possible exit. And then we have code key. Code key, generally that means that there's been some type of incident outdoors that has caused the outside environment to be unsafe. And so the hospital would require everyone to stay inside. They'll have doors that can be locked will be locked. Doors that can't be locked are going to be guarded by security officers and other hospital personnel to make sure everyone stays inside. So let me move on. I have some final thoughts, things to remember. No matter what else is going on, you need to follow your instructions that you're given by your managers, mentors, and project search staff. In an emergency situation, your safety and even your life may depend on following instructions that you're given. It may involve having to stop an activity, and it may mean that your normal sort of routine and workflow could be interrupted, but your safety and well-being are more important than anything else. By standing out of the way during a code blue or code 5, you can allow the person in cardiac arrest to get the life-saving help they need. So that's a very important one to remember. You get sometimes, unfortunately, called rubbernecking, or when there's an accident or disaster and people kind of want to, out of curiosity, I guess, want to check it out. They want to look and see what's going on. Don't do that. Remember that the person in cardiac arrest, that's a life-threatening situation, and they need help. They do not need a whole bunch of people crowding around, getting in the way. So during a code green, you're going to stay in your area away from the code location to avoid getting hurt. If someone has become violent and aggressive, you don't want to be anywhere near them. We're going to let the trained hospital staff deal with that and continue our normal activities. During a code pink, as I said before, you must stay inside until the code is cleared. That's because it'll make it easier potentially for law enforcement to find the person who has committed this abduction. And also, of course, you're going to stay alert, watch for suspicious activity. If you ever hear a code key, you must stay inside. And if you ever hear code echo, evacuate immediately. So those are kind of really opposites, of course. So pay close attention for those. They're not very likely to happen, but they are definitely possible. All right, if you evacuate your area due to a code red, use the stairs, not the elevator. So if you are up on, say, 4 South or something like that, and there's a code red and you're instructed by your manager, mentor, job coach that you need to evacuate, then during that code red, you need to use the stairs. Elevators can become inoperable, meaning they can stop working during a code red and you may get stuck in there, and you don't want that to happen. So use the stairs if you can during a code red. All right. So I hope that you remembered a lot of this stuff from before, because we've certainly covered it, but I want to refresh everyone's memories. It has been now several weeks since we've all been together at UTMC. And hopefully within a couple more weeks, we'll be back together again. And I want everyone to be prepared. And one of the most important things that you can do in order to be prepared is to know your emergency codes. So we will get together soon and discuss this information. And I'm looking forward to seeing everybody then. And that's all for now. Thank you.